All right, well, thank you all for taking the time to join us here. I feel very fortunate to be able to spend a little time just discussing this JHLT Open special edition that we will be doing on mechanical circulatory support. So I may just give a minute for others who may be joining after the hour to be on this meeting, and then maybe in like a minute or so, I'll get started and go through some slides to hopefully help everyone understand how to submit for this journal opportunity, and then we'll open it up for questions. So I'm just going to pause for a minute, give everyone a chance to join, and we'll get started. All right, well, hopefully everyone has had a chance to join here. We may have additional individuals that are joining depending on how their schedules permit during the course of the hour. But as I mentioned, this time we have here today will be spent to discuss this JHLT, or the Journal of Heart and Lung Transplant Open special edition for mechanical circulatory support. So by way of background, I had reached out to the editorial board at JHLT Open and talked about how we have some amazing individuals in allied health that could make contributions to the literature, but there has never been a special edition that specifically highlights contributions from allied health representatives. So they were willing to give this a try. So this will be the very first special edition that is particularly highlighting allied health staff submissions. And Thomas Schlöglhofer, who many of you may know, he is at the Medical University of Vienna, and myself will be co-editors. Of course, we will continue to rely on reviewers that are within JHLT Open to review submissions, but then we will kind of pull together some of the final touches and will likely do an introductory remark at the beginning of the special edition. Unfortunately, Thomas is not able to join us today. His daughters are ill, so he's home taking care of them. So you have me today, but I'm happy to field any questions either during or after this presentation. So with that, we'll delve right in. I think we already covered a little bit of this here, but one of the things we are really hoping to do in this special edition is to highlight the contributions that allied health staff make in the mechanical circulatory space. And to that point, we are specifically requesting submissions for this special edition that have a first author as an allied health representative or a senior author as an allied health representative. And as you'll see in the subsequent slides, if you do have that, you actually would qualify for a waiver, which would save a fair bit of money because a lot of allied health representatives, in this space that exists in our professional communities don't necessarily have research funding that they can utilize for journal submission. So we're hoping that defraying that cost will help to encourage submissions. So let's go through some of the details, and then we'll talk about how to actually submit for this, and then we'll open it up for questions. So first of all, when are these due? These are going to be due at the end of the month. We intentionally selected at the end of October. Initially, we were going to have an earlier due date, but I anticipate that many of you on here may also be submitting abstracts for ISHLT. So just as a reminder, abstracts are due on October 14th. So don't forget to get your abstracts in for the annual meeting next year, which will be in Canada. But Also, that gives you still 2 weeks afterwards to finalize your submissions for the JHLT Open MCS Special Edition. So what are we looking for? We're looking for submissions that highlight innovation, collaboration, and patient-centered care. These can be amongst any one of the items we have listed below, whether it's selection of patients, how to optimize patient care, what might interdisciplinary care models look like. Some centers do prehab or rehab post, different aspects in the care continuum. Some people have interesting research perhaps surrounding nutritional optimization, medication optimization, perhaps psychosocial support, telehealth, remote care, education, training, workforce development, patient optimization, essentially things that fall under the domain of MCS management. So if there's something you're doing and you're not sure if it would fall underneath you, feel free to reach out to Thomas or myself, and we would be happy to let you know if it seems like it would be in line with this special edition. We are accepting really anything from original research to case reports, literature reviews, or if there's something you have that doesn't quite fall under either of those categories, you can certainly reach out to us and see whether there may be an opportunity to submit for this, but essentially be the same types of article submissions that you would do for the regular journal. And as I mentioned before, submission fees will be waived for allied health first authors or senior authors. So please highlight that in your cover letter to this, that, you know, whoever is the first author or senior author is an allied health representative. That will be very helpful in ensuring that we can get that waiver applied for you. If you are interested in submitting an article for this and you have not yet reached out, please feel free to send an email either to myself at Schettle.Sarah@mayo.edu or to Thomas Schlöglhofer at Thomas.Schlöglhofer@MedUNIWIEN.AC.AT. And we can send you a link. We'll reach out to Elsevier and get the link for you so that way when you apply through that link, you can have the waiver for your submission. So if you're not certain if your research aligns with the MCS Special Edition, feel free to reach out to us and we can let you know if it seems like it would be within the scope for this journal. Now, just because it appears that it may be within the scope does not guarantee that your article will be accepted, because there has been a lot of interest in this. So not every submission will be able to be accepted, but certainly we would give it consideration. And by we mean us as editors, and then also the reviewers that would be assigned to review your submissions. So once you get this link, you'll get an email with a link for submission, and you can click on that link. And if you already have a login, you can use your pre-existing login. If you do not already have a login, it'll give you the opportunity to create an account on the JHLT Open portal. So once you have that and you're into the portal, your screen should look something like this. So I'm just going to drag over my mouse and hopefully you can see this here. So there's a home screen, a main menu, submit a manuscript, about, and help. And you're going to get something that says My New Invitations. And there will be an option here under action links. And then it will say, you know, what is the date that, you know, things are at? When did we invite you? You know, what is the title of the special edition that you're submitting for? And in this case, you should see something that says MCS, Patient Management and Optimization, an Allied Health Perspective. And then you can go under action links here, click on this, and then click Agree to Submit. And when you do that, you'll receive some sort of a notification that says, you know, thank you for agreeing to the invitation. Your invitation number may be different than this one because this is just a sample. And then from there, that will show up in your My Accepted Invitations folder. So when you go to your My Accepted Invitations folder, you can click Submit Invited Manuscript. And then some of you may have ORCID ID. If you have that, feel free to link the submission to it. If you do not, you can just click Proceed. It's not required to have one to submit to the journal. So that's this portion right here. You can either click link or proceed if you do not have an ORCID ID. Now, they're also going to ask you some questions about whether you used AI involvement. So we're hoping that you didn't just, you know, take your research, plug it into ChatGPT, and then have it create some sort of submission for you. We want there to be original thought and involvement. But if you have used AI in any capacity, you are required to disclose that in the subsequent steps. There will be a lot of questions that you will need to answer throughout, and it will guide you through each step of the way, basically clicking Proceed as you do each of the subsequent steps. And you can always return to home or main menu if you'd like. Now, After you go, you get to pass this first screen here. The next step is going to ask you to upload files. So you see here where it says attach files. You can either browse from, let's say, your desktop and select them to be uploaded, or if you have them on your desktop, you can drag them and then just drop them in this box right here. And you can click on either option, click proceed, and then that will take you through all of the rest of the next steps: general information, reviewer preferences, additional information, comments. It will guide you through each single step on here as you proceed through the submission. What are some important notes? So if you haven't submitted a manuscript before, we would highly encourage you to make sure that you have a mentor on this paper that can help guide you through the publication process, because it can be intimidating for people who maybe haven't ever done it before. I will say the JHLT Open format is very user-friendly. So even if you haven't done it before, it does guide you through the process, but it is nice to have somebody to ask for help or assistance. So in many instances, people may have a cardiologist or a surgeon or somebody who has extensive experience in submissions who they may wish to engage in their manuscript, perhaps to also help with statistical support or analysis, paper contributions. Just remember, you do need an allied health individual to be either first author or senior author, but we expect and anticipate that there will likely be physician involvement in most of these manuscript submissions. So when you go to upload your different files, it's going to make you indicate when you upload the file, is this the manuscript? Is this your cover letter? Is this the credit author statement? Is this your manuscript? Is this your declaration of intent? And then there's a lot of optional things, like if you have tables or images or things that are not required, but everything with a star by it, you are required to submit. So you will need to have minimally these items in order to complete the submission. So a cover letter is kind of an introductory, here is the article that we are, submitting. Here's why we think it is important and enhances the field of mechanical circulatory support. Your manuscript is obviously all of the content that you have. You need to make sure that you explain, who is contributing in what capacity, and I'll explain the declaration of intent a little bit later here. What is a declaration of interests? Declaration of interests basically is that all authors have to disclose relationships that could potentially bias their work, and Elsevier already has a declaration of interest form. So you basically can click on this link here, it'll open up the form, and then you can fill it out, save it, and then you can upload that underneath your declaration of interests or intent. So if you take this link here, it should guide you directly to it. You can also do it through the Elsevier portal. And I know that after we're done with this webinar, Juliet, by the end of the week, will be uploading the actual slides. So you can just download the slide and then click on this declaration of interests link right here. If you'd like to get to it that way, it is embedded with a hyperlink. It'll open in a new tab. So this is an important step that needs to be completed in order for submission. What if you're wondering about more information, or you're thinking, gosh, I'm not entirely certain what I all need, or if I've got all of the pieces? Remember when I showed you on the earlier screens, there is this home and all the different sections. You can go under the About section, and there is something called Guide for Authors. So this is a very helpful section for information, and it tells you, what would be recommended word count and some other helpful information just to help you feel a bit more comfortable knowing that you have the correct information for the particular type of article you intend to submit, whether it's original research or a case report or whatever it is that you are choosing. You can also go to the main menu on the home screen and click on the author's resources. There they have several guides that you can read, and they also have video guides. If you're more of a individual who likes to watch how to do it, they have video guides that essentially guide through the process of exactly how to do the submissions if you're looking for more help. So I would encourage you, especially if you haven't submitted anything before, to review these author resources and to watch some of the videos. They're quite helpful and they'll give you confidence as you go through the submission process. And as I mentioned before, don't forget to ask your senior author or the collaborating physicians who are involved with your research for help and guidance. They likely have done lots of papers in the past and may be a really good resource to help field some questions that perhaps you may not know the answers to, even perhaps after having reviewed the video guides or the author resources. Also, if this is your very first submission, don't forget, this is a new thing, so give yourself grace and patience. You don't have to do everything and get it all submitted in one fell swoop. I would encourage you to, get all of your information prepped and submitted, and then just pause, come back to it the next day and double check your work to make sure it is as you hope it to be. Sometimes it can be overwhelming to do it all at once. Certainly you can do it all at once if you wish, but sometimes taking it bit by bit or piece by piece makes people feel a bit more comfortable or confident. What are some things that could perhaps catch you off guard? There are some things that it will ask you in here. Now, you can choose to enter that information or not. So for example, it may say you can enter names for a reviewer that you would be opposed to considering. So if there's a reason why perhaps somebody should not review your paper that you think would perhaps offer some different type of bias, you may wish to say, Sarah Schettle should not review my paper because, she developed this technology that is in here and therefore she would have intrinsic bias, or whatever the reason would be. You also will be given an opportunity to enter an abstract for most of these submission types. So don't forget that you've got your whole manuscript, but you may also have to have more of a trimmed up version, kind of like you would submit for ISHLT, that has more of a synopsis of the work that you've done. You will be asked to enter keywords. So if somebody is interested in trying to identify your particular paper, you would want to think, what are things that would cue somebody into that? So you may want to type LVAD, left ventricular assist device, maybe stroke, GI bleeding, infection, whatever the content areas are that your paper touches, you can put those in as keywords. There's also going to be an area where you enter the authors in your paper. And you may think of, okay, I need these 5 people in here, you put them in, but maybe, your senior author, you accidentally have listed second. You can rearrange the order of the authors until it is the correct author order. And if you're not sure who should be in which order, this is again where you may wish to reach out to the mentor or the senior author, or perhaps, a surgeon or cardiologist who's involved with your work, as far as, who should be in which order, because sometimes there can be particular thoughts or perspectives about how that is best done. Once you have everything submitted and entered here into the portal, you will be given an opportunity to build a PDF. So basically it will include everything that you've entered, the questions you've responded to, the things you've uploaded for submission, and it will pull it all together in one large PDF that you can review. I would encourage you at that point, before you click submit, to take that PDF, download it, and send it off to all of the contributing authors in your manuscript and ask them if they have any feedback, thoughts, additions, deletions, anything that they want to change, because this is kind of the last opportunity to make those edits before submitting. If everyone is in agreement with that PDF, then you can formally submit. Then at that point, it will be given to 2 different reviewers that exist within the JHLT Open portal. So these are a variety of different colleagues and peers and surgeons and cardiologists and VAD coordinators and allied health staff, across the US and really across the world, that have expertise in different areas related to MCS, and they will have a chance to look through and say, here's some really great areas of your paper, but here's some things that should be included for it to really, have the impact that you're hoping for it to have. Or they may say it is perfect at baseline, but I will tell you it is very, very rare for a paper to be accepted at first pass. Most of the time, a paper will be sent back for revisions to include additional things to enhance the paper and add further clarity. Sometimes a paper may just not quite yet be up to the level of the standard required for a JHLT article submission. And they may say, thank you so much for this contribution, but it isn't quite to the level of research that would be needed for acceptance into this journal. Consider submitting to journal XYZ instead. So any of those could be a response. And there usually is some helpful feedback in here. What happens if you get stuck and you're not sure, as you do the submission, or you're not sure how to, do at any particular point along the way for the journal? Don't forget about that guide for authors in the About section. Again, they have all that helpful information in there. Don't forget about the author resources guides and the video guides. There may be one that addresses some of the questions that you've already had. Don't forget to ask your senior author or collaborating physicians for help. They probably have the most expertise in doing submissions. And again, give yourself grace and patience, like I said. So with that, I just thank you so much for taking the time. Thomas and myself and the editorial board of JHLT Open are very much looking forward to your submissions. We've actually received a lot of really great submissions already, so we're excited to see all of the different submissions that are still to come over the course of the month. We're excited to highlight the best of those submissions in this special edition. So we look forward to what you will be sending our way. I'm going to stop sharing here now because I wanted to make sure to allow enough time for people that maybe have questions or comments or things they want to know that maybe would help them in their submission. So with that, I'll pause. I do see there's one in the chat, so maybe somebody has included a question. No, Juliet has just invited us to use notes in here if you would like. So feel free at this point, if you have questions, unmute yourself and ask. If you don't have, if your audio isn't working, feel free to submit a question in the chat, or if it's easier, with your workplace, so you're not talking, feel free to type a question in. While I wait for some of those questions to come through, I will say that this entire webinar will be posted to ISHLT Connect. So if you'd like to re-watch it, if you would like to download the slides, all of those options will be available by the end of the week within ISHLT Connect. So thank you all for joining. I'll pause here and see what questions, comments, or feedback you all may have. It sounds like perhaps Carlos may be trying to say something, but if you are, you're muted, so I can't hear you if you're asking a question. Maybe not. Okay. Well, if no one has any questions, I will remind you that in order to submit an article for this special edition, don't forget to email Thomas or myself for that link. Again, our emails will be included in the PowerPoint, so you can just highlight those and then send a message directly to us, and we'll get you the link for submission. Feel free to ask if your research does appear to fall under the domain for this particular special edition, and we'd be happy to give you some feedback or guidance there. And if you've got questions, I'm happy to help. I'm very excited about this. I feel like I work with some incredible allied health individuals here within ISHLT and within this professional community. So I'm really excited to see what comes about through this and to highlight the important contributions that allied health members do make to mechanical circulatory support. I don't know if there's anything else, Juliet, you need from us, but doesn't seem like there's really any questions hanging out there. So either we just did a really good job or people are going to email questions that they have, I suspect. Okay, well, thank you all for your time. I hope you all have a wonderful rest of your Tuesday. Feel free to reach out with any questions or concerns, and I look forward to your submissions. Have a great day, everyone.